name is Afaf Osman. I'm an assistant professor at the University of Utah, Huntsman Cancer Center. And I primarily treat myeloid malignancies and preleukemia conditions, myelodysplastic syndrome, clonal hematopoiesis. I'm excited about a bunch of studies this year at ASH. I think it's been a great year. I think in the myeloid world, we're all excited about the menin inhibitors for our leukemia patients, specifically for patients with KMT2A rearranged myeloid leukemia and NPM1 mutated myeloid leukemia. There's been several of these menin inhibitors that are in development. A couple of trials are presented at ASH this year, the SAVE trial, the AUGMENT-101, and it's being tested as monotherapy. It's also being tested in combination with oral decitabine and venetoclax. And I think that's really exciting. The drug, I think, is called Revumenib. So that's a targeted therapy that we're really excited about in acute myeloid leukemia, especially in this relapsed refractory population. So that's one thing. I think another exciting thing is the plenary session is going to be on a monoclonal antibody that's used in graft versus host disease. You know, graft versus host disease is just terrible when it happens in the post-transplant population, and you have, you know, this great treatment that can cure patients in the form of allogeneic stem cell transplant, but then if you end up with a graft versus host disease, it can be really detrimental and can really worsen the quality of life of these patients. So I believe this is a CSFR monoclonal antibody that's going to be presented at the plenary. Its name is axatilimab. I think we're all excited about it. This is an area where there's not a lot of very good therapies. So I think that's very exciting.